are live right here in Greenwood, South Carolina. That's right. We have surgeons with us today, and the mics are defeating them. So, anyways, we're going to be having a good time here today. I'm Ann Eller, and yes, let's see if I can pull me up here for a second and just introduce our guests this afternoon. We have Dr. Ryan Bolt and Dr. Alexander Wang is here today. They are with the Advanced Surgical Associates, and both of them, they're surgeons. What can we say? They like to get in and get out. In fact, Dr. Wang was doing a procedure. Did you have a chance to clean your hands and get cleaned up before you came over here?
Quick wash.
A quick wash. Well, that's great. That's great. I'm glad you're here. We want to talk a lot about robotic surgery, but first I think we should talk a little bit about each of your backgrounds here. So, Ryan, Dr. Ryan Bolt, you're a general surgeon with Advanced Surgical Associates, physician practice at Self Regional Healthcare. Where did you get your degrees from, Ryan?
Well, I started in Buffalo, New York, where I'm from. I went to Canisius College for undergraduate, did a chemistry health professional track there. Took a couple of years off to work and mature, so to speak, and then found my way down to Blacksburg, Virginia, where I did a post-bac program, kind of a prep program for medical school, and then I did 4 years of medical school there at VCOM, it's Edward Via College of Osteopathic Medicine. At that point, afterwards, I went up to Michigan, and did 5 years of surgical training at Beaumont Hospitals outside of Detroit.
Oh. Now, what made you decide to go to become a doctor or a surgeon? What made you go that route?
Growing up, I always admired physicians. I always whenever I had the chance or whenever, for whatever reason, I was in the hospital, I always thought that it was somewhere that I wanted to work. And Did
you have family that was in the medical field?
No, I'm the only physician in my entire family, actually.
Oh.
Yeah.
Okay.
Yeah.
So,
it's just an aspiration that I kind of developed.
And then why a surgeon? Just out of curiosity.
You have the opportunity to fix things definitively, as opposed to manage chronic conditions indefinitely with medicines and such.
So, in other words, you like being able to see them once, twice, thrice, and then be done. Is that what you're saying?
I mean, if they're fixed, then that's perfect. They don't want to see me anymore than they have to, I'm sure.
Exactly. I understand. And so, how did you end up here in Greenwood?
After residency, we make kind of ads, or not profiles, I would say, on these different job boards, and the recruiter reached out and scheduled an interview, and it just checked a lot of the boxes that I was looking for. Had a robot that we're going to talk about. The area is nice in terms of lots of lakes, smaller town.
It's not real cold most of the time.
Warmer, yeah. I wanted to be in the southeast United States. That was kind of like my target geographical area. Yep.
Yeah. And so, do you like to snowboard or any of these type of activities?
Snowboarding, yep. Jet skiing and all the water sports too. We try and do a couple, maybe 1 or 2 trips a year snowboarding though, yeah. We just got back, actually.
Yeah.
Did you?
We were in Aspen for a conference. Mm-hmm. Dr. Wang and I went there and for this conference called Updates in General Surgery, put on by the Cleveland Clinic.
And you came back all in one piece.
One piece, all the fingers, all the bones intact, yep.
Oh, that's cool. All right. Well, then we have Dr. Alexander Wang, and you're a general surgeon also with Advanced Surgical Associates. And you earned your undergraduate degree from the University of Georgia in Athens, and then you got a medical degree from the College of Georgia at Augusta University. Are you from the South?
I am. I grew up mostly in Atlanta.
In Atlanta?
And so that's why I did most of my schooling in Georgia and Athens and Augusta.
Yeah.
And no, pretty similar story, Dr. Bolt, where I did take some time off after college as well. I actually became a teacher for 3 years.
What did you teach?
I taught English abroad in China for 3 years at a university.
How was that experience?
It was wonderful. It was... I always enjoy teaching, and at that time, I was also learning Chinese, so I thought what better combination would have been, because I minored Chinese in college, and so I decided to go out there and live out there and learn Chinese while teaching at the same time, and getting to travel a lot and seeing a different culture. Because even
Had you
though
ever been to China before? in
I
your
had
family?
not, I'm ethnically Chinese, but I was actually born in France, and so I grew up in France, and I moved to the U.S. when I was 10. And so to me, it was still very much a cultural kind of assimilation, getting used to, and things like that.
Sure.
So it was a very good experience. I enjoyed it. You know.
So why did you give up teaching?
Well, I always loved science, and I knew that at some point I had to choose a career, and that's kind of where medicine fell into place, because I thought that was a good combination between, when I was teaching, I could see my students improve and learn and grow, and I thought I could apply my love for science for medicine and do the same things where I can have patients instead, become better and heal and things like that. So
Why a surgeon?
Well, I'd say surgery was the only specialty, when we go through medical school, you kind of rotate through all specialties. Mm-hmm. It's really the only specialty that I felt like I wasn't really working. Like I would go to my rotation and enjoyed it so much, I would just naturally do it, naturally want to be there for every surgery and see patients late at night. And I thought, okay, well, this makes sense then. If I'm doing something that I don't feel like it's work, that's just going to be more natural for me. So that's why I made a very last minute switch to surgery. I thought I was going to be an internal medicine doctor all the way up till the end of my third year in medical school. So it was a very last minute switch. Yeah.
That's cool.
Yeah.
That's cool.
Yeah.
They always say surgeons are kind of, I don't know if you guys qualify for this, but surgeons are very opinionated and know it all, and just get in and get out, and that's it. What do you feel? Having been a teacher and all this type of thing, what do you think, Dr. Wang?
Well, I think that there's a stigma with the idea of surgeons, and I
Right.
think that perhaps there's an old view and maybe an old guard of surgeons who still uphold that kind of view. But I think it's changing. Times are changing, and I think that hopefully we don't always give that sort of impression for everyone. I think we both can say we're always learning. Mm-hmm. We go to conferences every year together because we know we have to stay on top of the newest research, the newest data for people to have better outcomes. And
Sure.
so with that, we have to inherently admit that we just don't know everything, and that knowledge is constantly changing, So.
Yeah. Well, I also understand that you're always tracking down a great burger. So where are the good burgers in Greenwood? Are there any, or should we say that you have to go far away to find a good burger?
Man, so I'll have to apologize for this. I haven't done my due diligence in exploring that yet. I have had many wonderful patients that have come to me and expressed to me, hey, you should definitely go here, you should definitely go there. I can't make any absolute recommendations yet until I actually try them myself.
How long have you been here in Greenwood?
A little over a year.
A year?
So you're right. I should be better on that.
Okay.
But
But when you were in Aspen, is that where you were in Colorado?
Yeah.
Did you find a good burger there then?
Did we get a burger in
Yeah.
Aspen? You did?
Yeah, that one bar, the double stack burger you had,
Oh, okay. Yeah.
the one tavern, yeah.
Oh yeah, that was delicious. You're
Yeah,
right. Yeah,
yeah.
we did go to a good tavern out in Aspen that had a very delicious double stack burger. You're right.
Okay. All
Forgot
right.
about
So
that,
you,
yeah.
you did find a burger
Yeah.
or two.
We try to. Almost every trip we go to at least one good burger.
Yeah.
Yeah.
Okay. Well, I was just curious. I saw that track. You're always on the looking for a great burger, so I
Well,
had to
if
ask you about
if
that.
you've got recommendations, we're open to it too.
So you're
So,
always
yeah,
looking
yeah.
for good recommendations.
Yes, absolutely. I'll put it on a list.
Okay, well, we just had a comment come in on Facebook Live, and it says, excellent surgeons. Our community is blessed to have both of them. Jeff Langford said that, yes. Yes, so there you go. So see, we're already getting comments. We are live on Facebook here today. We're also on the radio. Our special guests here today, Ryan Bolt, Dr. Ryan Bolt, and Dr. Alexandre Wang. Dr. Wang just had to walk in right at the last minute. He was doing a procedure. We're blessed to have him here this
Happy
afternoon.
to be here. Thank
That's
you.
right. That's right. All right. So, we wanted to talk about robotic surgery, and we also want to talk about colon cancer awareness and treatment. And I understand this is something we're trying to expand in our area to let people know that this is an available. We know I think most people know we have robotic surgery here. But the colon cancer, who would like to talk about that? Ryan, would you like to maybe talk a little bit about
sure.
that?
Well, since we've purchased, or the hospital has purchased, a couple Da Vinci robots, we are trying to expand the offering and just make people more informed that we're performing minimally invasive robotic colon surgeries for masses or unresectable polyps that are seen on and found on colonoscopy. And there's numerous advantages that I'm sure we'll get to talk about to the robotic platform. And, it's basically, we're just trying to bring awareness about it.
Well, when we talk about what is the difference in the downtime with regular surgery versus a robotic surgery?
Yeah, so I mean, historically or previously, you would sometimes get a very large incision, almost encompassing your entire abdomen, right in the center, and clearly that's going to be associated with a lot more pain.
You got to go through muscles, right?
Yeah, longer recovery and delayed return of bowel function, and sometimes it can be associated with something called an ileus, where your bowels slow down and you're nauseous and vomiting. So the advantage of the robotic platform is we make 4 small incisions and one that's slightly larger to remove the specimen, and we're able to be much less invasive, and therefore you have less pain, you require less narcotics, you have less risk of a hernia, you're up and moving much quicker, and you're basically back home faster than if you were to have it the old-fashioned way, so to speak.
Now, you told me something very interesting before we came on the air, that the surgeon still has to make the incisions, though, right?
Yes.
Yeah, it's not all robotic, and I thought it was all robotic.
No, it's not to that point yet. We're using the robot. It's a tool that we're still using. It's, every movement and every cut, so to speak, is at the direction of the surgeon controlling the robot.
How does it feel to do that kind of stuff? I mean, I suppose you had done regular surgery before you got into the robotics, or have you always done robotics?
All through training these days. I mean, the robot is something that we're, every resident at this point is doing throughout their...
Well, had you had it in your residency?
Yeah.
Dr. Wang, how about you? Was it in your residency?
Absolutely. Most programs are incorporating it now, so it's a big part of our training.
Yeah. Now, let me ask you something, though, because this is kind of scary. What if you really needed to do regular surgery? Could you do it? That's the question.
Absolutely. I would say
absolutely not. Is
absolutely, we can. Yes, and that's something that we always have a fallback. And it's always open surgery. And I feel like we are still very well capable in doing open surgery, but it takes definitely extra training and to
what
be really
takes extra training?
The robotic surgery to be able to offer that. Because most programs start off with open surgery, and then they incorporate laparoscopic surgery, and now with the new technology of the robotic platform, there's another kind of steep learning curve to that to offer that. And that's why I think it's important to highlight that not every institution, not every surgeon will be able to offer a robotic surgery for patients.
Now, how big a deal? How expensive are those machines? Any idea? I mean, I have no idea. How much is a machine?
Yeah.
$2 million.
$2 million.
Yeah.
And you have 2 of them?
Mm-hmm.
Is that right?
Yep.
The newest one's a little bit more, actually. They have a new iteration.
Yeah.
A new one?
It's about 2.5, yeah.
How does it feel? Now, come on now. How does it feel to work on a machine that's $2 million?
I mean, to be honest with you, I don't think about it that often. It's like normalized at this point. It's just the standard that we've been accustomed to.
The standard you've been accustomed to living to. Yeah.
I'd say I'm very appreciative that the hospital is willing to invest the time and financial kind of portion of this to invest in a robotic platform to offer for the community, because not every single, so I came from a level 1 hospital in Atlanta, Grady, and throughout my entire training, we only had one robotic, platform to offer to people. Some of our wait time was up to 6 months for surgery.
Oh my gosh.
Yeah. So I think here, self-recognizing the need and being willing to invest in it, I think, is a huge bonus for our community.
Absolutely.
You know.
Absolutely. So to have those type of machines here, so how does this benefit for a colon surgery? Since we're trying to highlight, I think, colorectal cancer, and also I understand that March is colorectal cancer awareness month coming up. Yes.
So everybody get your colonoscopies, especially if you're 45. If you're 45, the old age recommendation was always 50. But if you haven't seen in the news, there's been increased reports of younger and younger people getting diagnosed with colon cancer well before the age of 50. And so they've recently, in the past 5 years, decreased the age to 45.
So, question, why? Why are we seeing more? Diet? I mean, does diet have a lot to do with it?
That's probably, I would say, the number one suspicion. The amount of processed foods, processed meats, red meats, things like that has some association but no direct correlation to say for sure that that's going to cause colon cancer.
Right.
But that's our biggest suspicion.
Not as many vegetables, right?
Yeah,
Not enough fiber.
Yeah, enough
That's
fiber.
one good thing.
Processed foods, most likely.
Yeah.
And which are probably more and more processed these
And
days.
low in fiber. Yeah, absolutely.
That good Southern food, right? Well, so if they're now recommending them at 45, that is pretty young.
Mm-hmm. Yeah, and people shouldn't be take that as I'm 45 or I'll wait till 45. I think anyone who has any concerns or change in symptoms, unexplained abdominal pain or blood or anything abnormal, to just go ahead and seek, consultation with at least your physician, and then. Because maybe you could get it beforehand, and if you qualify for it, that is definitely something insurance will pay for and cover. You have a reason to get it.
What about these box colonoscopies that they advertise that you can do it in the privacy of your home?
Yeah.
What about those? What do y'all think about those?
I think it's a substitution at this point. It's not quite the standard of care yet. I still recommend patients undergo a formal colonoscopy. There is false positives, false negatives, and if you get a positive result from a Cologuard test, they're going to do a colonoscopy.
You still need one. Yeah.
Right.
Yeah.
The standard of care is a colonoscopy, and that's what I recommend. Unless someone is adamant, if they're adamantly opposed, then this next best option I think is probably the Cologuard test.
Okay. But colonoscopies, are they still as nasty as they have been, with all this stuff you need to drink and all this kind of stuff that everybody always complains about?
Well, in order to see, we do have to clean out the colon.
Yeah.
So it's a necessary evil probably, but once
have
a
they
year.
Improved? Have they improved? Have they improved, or no, not really? Or do you know?
There's different bowel preparations, and that's physician specific on what they use. Some are less volume, some are a little bit more tolerable than others.
Right.
But that's going to be case by case. There isn't one bowel prep that everybody has to use to clean their colon. So experiences, I think, are variable in that regard.
Mm-hmm. Mm-hmm.
Well, this is an uplifting topic to be talking about this afternoon, isn't it? Yeah.
So.
But all right. So, what is the importance of early detection? What makes the difference?
Well, if you think about it, from detecting a polyp that's precancerous, from that time to development of cancer is on average about 10 years. And that's why the thought is, if you have a negative colonoscopy and you develop a precancerous polyp soon after that, if you at least get another colonoscopy within 10 years, you should be pretty safe. So I think that's the whole idea, is if you can catch a precancerous polyp before it turns into, because once you have a precancerous polyp, it will become cancer. It depends on how aggressive it is and the size and many other factors, but as long as you have one, it will turn into cancer. So that's the whole goal, is catching it before that point.
And I think, isn't colon cancer one of the most curable cancers out there?
If caught early.
Yeah.
If caught early,
absolutely.
right? If it's
Yeah.
caught early,
Yeah.
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 So that is from that standpoint. So, so when we're talking about the robotic surgery and everything, what does the robotic surgery? Do you go in and get these precancerous polyps? What do you do?
Occasionally, if they're endoscopically unresectable, meaning that the gastroenterologist can't remove the lesion in its entirety, then sometimes we will do like a resection or remove a segment of the colon and then reconnect it to basically enable a complete removal of that polyp so that it doesn't continue to grow and become cancerous in the future. And then
Do you have to cut into the colon to do that with the robotic, or what?
we do not, no.
Okay.
No. We based on where the lesion is and the associated blood supply, we perform like a segmental resection or cut a section of that colon away and then reconnect it without ideally entering into the colon.
I mean, inherently, yes, the colon will be entered during the surgery, and that's why we have everybody do a smaller prep to clean out their colon, so we reduce the burden of bacteria to reduce the risk of, infection and things like that.
Yeah. The other question might be like, how do we know where it is if we don't go into the colon?
Yeah.
And that is because the GI doctor would have placed a tattoo that we can see on the surface of the colon when we're looking inside.
Interesting. But a colon's very long, right? I mean, don't they say it's? I mean, I don't remember how long, but it's pretty long, right?
Definitely,
Yeah.
definitely.
So there can be a lot of areas there. Do you do any? And when somebody goes in the hospital for something like that, how long would they stay in the hospital? Average. I know it could
it's
vary.
variable, but in general, I usually tell people 3 to 5 days, and I think with the robotic platform, we're trying to get closer to the 3 or
Yeah.
less mark. Sometimes even 2 days.
And I think that highlights kind of the difference, because you asked this question earlier about, we talked a little about open surgery, and then you mentioned what's the difference or advantage with robotic surgery. In between all that, the progression of surgery has changed where over the past 15, 20 years, there was a lot more people getting laparoscopic surgery. And so laparoscopic surgery is also considered a minimally invasive surgery, just like robotic surgery. But I would say one big step off or advantage with robotic surgery is that when you're talking about reconnecting people's bowel back together, you can do all of that robotically inside of their abdomen. A lot of laparoscopic surgery still requires a bigger incision to bring the colon out and put the connection together, almost like an open surgery. But robotic surgery allows us it gives us so much dexterity, control of the robotic arms. It's almost like we have hands inside of their belly doing all the fine sewing in the belly.
Now, when you're doing that, are your hands actually in a robotic
Correct.
Yeah.
fitting
Yes.
into it?
Correct. There's a little control on the robot that almost mimics arms that we control for the robot inside of their abdomen. Yeah. And so with that, you can kind of see the advantage of doing all that inside of their abdomen is that none of the bowel gets exposed to air, none of the bowel gets handled by our hands, and there's less trauma, less tissue handling, and that's why they recover faster. And so when we talk about how long they stay in the hospital, typically if it's like a right colon surgery, most people can leave by the second day. Whereas back then with the larger incision and bigger surgery, they're taking much longer to recover.
And much more opportunity for infection. And
Correct,
everything,
bigger
right?
incision, yeah.
Yeah.
So usually 3 to 5 days, 2 to 4 days. It's much shorter stay for sure. Yeah.
Wow. And now, but what about cost? What about cost? Where we're using this $2 million robotic machine. Now, I mean, how does the cost? How do they figure costs? Or is that something because of insurance and everything? It's not something that we should be concerned about.
Well, I mean, I don't know exactly the differences in cost. I mean,
Right.
certainly there's going to be an associated higher cost with using the robot and the associated instruments that we have to use to do the surgery, but that's kind of maybe offset by the shorter length of stay.
Correct. Yeah, and this is something that is studied a lot, especially with the old guard protecting laparoscopic surgery. the idea is, why do you need such an expensive tool to do the same surgery? But when you have people who recover faster, who stay in the hospital shorter, have less pain, then inherently when you look at the entire hospital stay, the cost can be less because they don't stay as long. They have less risk of wound complications. And so taking that together, yes, up front, the platform is a little more expensive for the hospital for us to offer, but the overall care and stay and recovery overall would be beneficial to the patient and the hospital.
And I would expect that we are dealing with mid-age to older people that would be having this surgery too, and that's always a risk too, isn't it?
Correct.
Yeah.
Yeah.
Well then, this is something that is we need for people to know that this is available. Now, what type of wait time is it to be able to go under the robot?
Yeah, I mean, it varies, but I think it's can be based on acuity. If there's a high need, then we'll fit you in type of situation. Correct. But in general, it's usually within a month or less. Most often,
right.
I'd say a month is rare at this point, but a couple weeks. And sometimes colon cancers require additional workup before we do surgery. We have to make sure that they're optimized to undergo surgery. Maybe they need a heart doctor cardiology evaluation, pulmonary evaluation. They might need additional imaging studies, lab tests. So we get all those things done while we're in between the date that we see them and the date of surgery.
Now, what about anesthesia for this procedure? Do you have to be totally knocked out?
Yeah.
Yeah. Well, I mean, I just wondered. I mean, you guys are talking here. I just thought maybe you could just do a little local anesthesia and just.
No. Yeah. Totally out, intubated with a breathing tube, and completely out.
Totally gone.
Yeah.
Totally gone.
Yeah. Well, I guess one other thing that maybe we can talk about is one of the benefits is the extraction site. We talked about
Correct. Yeah.
Not having a very large incision to do this surgery and have to pull on the abdominal wall for exposure and all those things. So when we take the specimen out, we try and do it in the lower abdomen called the Phalansteal incision, which is a horizontal incision. Most people might know it as kind of like the C-section incision.
Okay.
And by extracting the specimen there's a dramatically less risk of a hernia forming after the surgery. Like I just looked up a recent paper before we came. It's like 2.7% compared to greater than 20% with a big, large midline incision. So that's a huge advantage.
That is a huge advantage.
Yeah, that's a huge advantage. And then of course it's just far less pain, as we've talked about.
Absolutely. Well, we are here with Dr. Ryan Bolt and Dr. Alexandre Wang. They are surgeons with Advanced Surgical Associates here at Self Regional. And if you have a question, 864-332-9355. That's 864-332-9355. We're going to hear a quick word from our sponsors that make all of this possible. So don't you go away. We'll be right back. This is Meet Me at the Diner with WCRS with Dr. Ryan Bolt and Dr. Alexandre Wang. Stay tuned. We'll be right back. Take it away, and that we shall. And here we go. Take it away.
Trashy Lake Greenwood or pristine Lake Greenwood? The choice is yours, Greenwood. Your opportunity to keep Lake Greenwood beautiful is in your hands. Join us on Saturday, March 14th for the really big annual Lake Greenwood cleanup. Donate yours and your family's time. All supplies provided for the cleanup, and yes, there is a free lunch. When? Saturday, March 14th, 9 to 12. Register at our Facebook page, Keep Greenwood County Beautiful, or our website, keepgcb.com. Free lunch provided by Break on the Lake, Papa John's, Chick-fil-A, and Pepsi of Greenville. Be the solution, Greenwood, not the pollution.
Self Regional Healthcare is currently hiring for clinical and support staff positions. At Self Regional, we strive to create the best experience for our patients and our team members. We offer flexible schedules, competitive pay, and generous benefits in an environment that is supportive of your individual needs. Come see what makes Self Regional a great place to work. View our current job openings at selfregional.org/careers.
Are you passionate about life? Always wanted to see Tim Tebow in person, not on a screen? Hi, I'm Brenda, and Road to Life 2026 with Tim Tebow is an evening that brings our community together to stand for life and support those facing unexpected pregnancies. Join Crossroads on April 16th at Lander University Finnishorn Arena for a night with Tim Tebow as he inspires us to live fearlessly and put love in action. Every life has a story and every choice matters, and living fearlessly through compassion can change a future. Learn more about sponsorship opportunities and get tickets at crossroadspregnancycenter.org. This year, our sound is brought to you by Andy Sikora with Cal Productions. See you there Thursday, April 16th.
There's no place like this place anywhere.
Hey, did you see Bob? He just tried a yoga class, upside down.
And Jane just swam 10 laps while juggling her water bottle.
Somehow, I feel like I belong here.
You do. This is the Greenwood YMCA, where everyone's having fun and everybody knows your name.
There's no place like this place anywhere. Come join the fun and make 2026 the year you belong. At the Greenwood YMCA, there's no place like this place.
Oh, that's right. We are right back here at WCRS Radio, and yes, I am Ann Eller, and yes, I am here with Dr. Ryan Bolt and Dr. Alexandre Wang, both of them with Advanced Surgical Associates, and they get to work on the robotic machines, and they do wonderful things. I'm told, I haven't had the pleasure, but I'm told it's wonderful, so we're going to talk some more about it. You know, one of the things that I think a lot of people may not even know that they can come to, you know, after you've had a colonoscopy and may have an issue that needs to be checked out, right? How would they go about doing that?
Well, I think at this point we're able to see essentially anyone that wants to be seen. Referral isn't necessarily even required. So if they have something that they feel might be a surgical problem, then we're happy to evaluate them, and they would just call our office and make an appointment with us.
Right.
Yeah.
So so you don't have to go out of town.
You do not have to go out of town, no.
That's right. So that's another good thing here about this service. But again, just think about the fact that Self Regional has two of these mega robotic. What are they called? What's the name of them?
Intuitive surgical. It's called the Da Vinci robotic
the
system.
Da Vinci.
Yeah,
yes.
Da Vinci.
Da Vinci.
Yes.
Why was it named Da Vinci? Do you know?
I do not know that answer.
No, I just was
Question for our
curious.
rep.
That's a good question. We'll ask the rep about that.
Well, I mean, it'd be interesting. Why is it Da Vinci? So, anyways, now, what other things do y'all do with Advanced Surgical Associates? And particularly, I think, well, you said most everything is with these Da Vinci robotic machines, right?
Yeah, no, I think when it comes to elective surgery, we incorporate the robotic platform for a lot of them, including, any other hernias, whether that's inguinal or ventral or kind of hernias in your abdomen. But we do offer almost any other kind of the broad range of surgeries in terms of open surgery, soft tissue masses. We do take out gallbladders or appendixes and things like that.
You do the robotics for the gallbladder
We do
removal
incorporate
and-
for the robot for that as well. Yeah. Mm-hmm.
So, well, that is, I think sometimes we don't realize all the services that are available right here at Self Regional, do we?
It just depends.
Yeah.
Yeah. I mean, I think we're quite aware of it, but we just wanted to make sure that, those that don't know are now informed of what's available.
Yeah, so we are talking with Dr. Ryan Bolt and Dr. Alexander Wang right here. Two interesting guys that come from very different backgrounds that are both surgical associates, and they are here to talk about all the different aspects of this robotic. Now, what is it? Do you feel powerful when you're doing the robot? I mean, I don't know. I mean, I could just say, I'm going in now. I mean, it's kind of like some of the games and everything. Do you ever feel like that? Are you good at any of gaming or anything because you've had this experience with the robots?
I mean, I did play some video games growing up.
They
did have some studies that showed that surgeons who can apply the robotic platform tend to have a background in some sort of hand-eye coordination.
Are you still doing it now? That's what I want to know.
Nowadays, no. I think that's in the
play
old days,
occasionally.
yeah.
Do you?
Sometimes,
Yeah.
going on little sprees where play some video games, but
Yeah,
not
yeah.
lately. But
Yeah.
So are you trying to check out, do I still have it or not, or does working with the robot help me here or not? Now, what do you think the future? What do you think the future of robotic surgery, particularly as it relates to AI? What do you think is going to happen? Could you guys be out of a job someday?
I'm not sure about that. I don't know if society would support that, and ultimately you need to have somebody that can set it up and be say you're doing a remote surgery, for example. That might be coming down the pipeline where you have an very advanced and very technically challenging surgery. Maybe a big cancer surgery involving the pancreas, for example, or something like that. And the patient the patient is in a remote area where they have a robot, but they don't have a surgeon that's trained to do it. With the high-speed internet, you could technically probably have somebody control the robot over the internet and instantaneously be doing the surgery. And maybe they're in a different state or country.
Oh my God!
Yeah, but to do that, you would need a skilled and trained surgeon there to set it up, number one, and then to be there in case anything went wrong, to open the patient and fix whatever problem happened. So that's a potential for that to come down the road.
Yeah, the ability to take distance away, and because right now with some of these robotic platforms, they already allow surgeons from all over the country to tune into a surgery and watch it real time, and there are some countries that have already attempted kind of cross-country surgeries like this, but that would be kind of the next barrier, is taking that space away and people being able to be offered complex surgery from surgeons from all over the world. Yeah.
That's wild, isn't it? To think about. I mean, to think about when you suit up to do your surgeries and everything, you could actually have somebody in a different location eventually, or somebody could be coming into self, for example, right?
Mm-hmm. Or maybe a portion of the surgery is very complex and needs something super subspecialized, and so maybe Dr. Wang or I do the surgery, most of it, but then this one portion, maybe it's a specialty that we don't have here, and maybe down the road, they log in and do that section, and then turn it back over to us, type of thing.
Now, how long have you been a surgeon, Dr. Bolt?
Going on 8 years now.
8 years. And Dr. Wang, how about you?
A little over 7 years, almost into 8 years. Yep.
Now, when you think back, has time really changed in the last 7 or 8 years for surgery? For both of you. I mean, you said you learned on the machines, but I'm sure the machines have improved in everything.
Well, I think that overall, the general surgery care is there's like a baseline, and then as we do more research and add more technology, we just kind of change small details of our practice, and I think that's what changes the most, is the technology and the updated research to kind of slightly tweak our practice. I
think the use of the robot is becoming much more widespread and almost becoming more of the standard of care for many surgeries.
Right.
Because of the, some of the benefits we talked about.
Absolutely. And let's just go through, in case we got some people that may be tuning in, what are the benefits of robotic surgery?
Well, we talked about a lot of these more complex surgeries where we're able to do everything inside the abdomen and allow patients to recover faster. Another big topic is pain. The robotic platform, with the way the arms are set up, they allow for slightly less torque on the body wall, and the idea with that is that with less torque, there's less pain associated with them recovering afterwards. So needing less painkillers and things like that.
An amount of time that you'd end up spending in the hospital, probably.
Correct.
And we were talking about, I think, less possibility of infection because
Correct.
it's not opened up in this type of thing. Now, here's an interesting question for you. So when you tell somebody you're going to do robotic surgery on them, have you ever had anybody say, hell no?
I have not. No, I have not.
I think thankfully that by now most people have understood that this is kind of the new platform that we engage in.
Right.
I think I've had maybe one person ask me, so is the robot doing the surgery or are you doing the surgery?
Yeah, I've definitely done that disclaimer. The robot is just a tool that we use.
Right.
We're still doing the surgery.
Now you've used that as a disclaimer.
Oh, yeah.
Okay. Because I can see people going, I don't know about this. Yes. So, and you don't call, do the robots have names?
I thought one of my co-residents at her hospital in South Dakota, they named their robots, but it's something for South to consider. Maybe we can, make
a naming contest,
a naming event, and make a
group
poll.
consensus.
Yes. There you go. That could be interesting for South.
Yeah.
Well, this is, I think, so much interesting information. It really has brought a new light on how to deal with colon cancer, the awareness and the treatment of it. And you are able to do so many different things. What, Dr. Bolt, what would you like people to know about Advanced Surgical Associates and the experience that they probably would have and any of those things?
Just that we're available and here to serve the community, and we'd be happy to evaluate any surgical problem that they have and give our opinion and see if we can help them. And I think that we're providing great outcomes right in Greenwood.
The nice thing is not having to travel, right? And to have this type of facility here with two, not one, but two robotic machines here is pretty amazing right here for our community, and does go to what Self believes in serving our community. Mm-hmm. Dr. Wang, what about you? What do you think that you would like people to know?
I completely agree with what Dr. Bolt said. Some of these complex surgeries, you don't have to go to another major city to do. We Dr. Bolt and I feel like we're very dedicated in the training and the learning. We travel multiple times a year to stay up to date on the newest research, data, training, to bring that back here to offer to our community so that they know that, we offer the most up-to-date, not only surgery available, but also techniques so they can have the best outcomes.
What was one of the most surprising things you learned on your latest trip when you were in Colorado? Was there anything that was outstanding that you said, wow, I didn't know this, or anything? Or
some of it is just more so kind of refreshing, and it's usually, a lot of times it's just little tidbits and little tricks, little different nuances about how to make things just a little bit better.
Tweaking it.
Yeah. One of the big things that we started doing after this conference was whenever we make a new connection for when we do some of the colon surgeries that are down lower in the pelvis, we use a colonoscope basically, and we've been doing leak tests with that, and I think that's allowed us to be more confident in the connections that are made and evaluate them in a better way. And also actually look inside the colon and look at the connection itself. Is it circumferentially intact? Is there any bleeding? How does it look? That type of thing. So it's just one small tweak that there's many different ways to test it, but this is what we've found is a better way.
Well,
So that's an example for you.
Right. Well, I mean, I think that that's type of thing. And how prevalent is colon cancer in our area?
I think it's prevalent in all areas, not just our areas.
For sure.
I don't necessarily have a specific number to give you, but it's certainly on the rise, and unfortunately we're seeing more advanced cancers in younger populations, it seems like, over the past maybe 5 years or so. And to me, maybe it's just my bias because of being out in practice, but it just seems as though younger and younger, unfortunately, we're seeing more advanced cancers.
Are there any other cancers that you use the robotics for?
Well, it can be used on a lot of different cancers. Pancreatic cancer, liver cancer. It could be used for gallbladder cancer. Some of those things aren't really, they need to be, because of where they are and because of what's involved in doing those resections, a lot of times those are done at larger institutions. We're not quite doing Whipple procedures, for example, and those types of things.
Interesting. Well, we are here, like I said, we are here with Dr. Ryan Bolt, Dr. Alexander Wang. They are experts in the Da Vinci robotic system here, soon to be having their own names right here in Greenwood, because we discovered a need for these machines to be named. Now, let's see. We just had another comment come in. Thank you for using your skills and knowledge to help our community. You are appreciated very much. May God's richest blessings, oh, and there's more, let's see, be yours and today and always. Miss Judy Davis, who is a big fan of WCRS and all the programming that we do here. So we have talked about a lot of different aspects here. What do you think the future, just as the future with AI, do you see anything changing? And is there another type of machine that you need? Because here we are, right here on the radio. We have Mark sitting right over there. We have doctors listening. Is there any other types of equipment that y'all need here? Just thought I'd mention that right now.
Well, I mean, I think with this new age of AI, it's changing the entire field for almost every sector of our lives. I think in terms of robotic surgery, Intuitive is very advanced, and they take a lot of our data and surgeries into consideration. And there's AI that's incorporated with their newest Da Vinci platform to basically make sure that we continue to stay safe, that everything that we're doing is, it's able to kind of tell us this is a high risk area if you go into this area and things like that. But it's yet to fully be seen how that's truly going to be incorporated and applied.
That's well, I think that's with everything, right?
Yeah,
everything, right?
Yeah.
Mm-hmm.
So the big thing is, if you have an issue or your doctor thinks you should have an issue, you should come to Advanced Surgical Associates and get an opinion.
Mm-hmm. Yep.
Absolutely.
As we discussed, you don't even need a referral. You can just give us a call and make an appointment.
All right, and that would be a good thing. You don't happen to know the telephone, do you?
I don't know if that was
okay. I figured as the doctor there you probably wouldn't. But anyways, it's Advanced Surgical Associates, and they would love to talk to you. And do you ever do, I'm interested in this myself. Do you ever show off the machines, the robots?
We have done a few demos out in the lobby where Intuitive Surgical, who makes the robot, brings kind of a demo robot in. And early in residency, there's a lot of different modules and whatnot and little games that you play with the robot just so that you learn depth perception.
Games? Yes.
Yeah.
It's like kind of moving a ring down a tube and you can't touch the ring at the tube, things like that.
Practice suturing.
Practice suturing, transferring pegs from one area to the other without dropping them. So that's been showcased a couple times in the lobby.
Mm-hmm.
Okay. Well, if you ever do that, I would like to be invited. I'd like to come see that and see how that all works. I think that could be interesting.
Yep.
Yeah,
we'll
I
let
think
you
that
know on
could
the next
be really
one. Yeah.
interesting. Well, we are going to, Dr. Wang, what are you having for dinner tonight? Would you be having a burger?
Maybe I should if you have a good recommendation, you know.
Does anybody have a good recommendation out there in Radio Land where they should go have a burger? I mean, there are all kinds of burgers here in this town. But we are going to wrap it up. I want to say thank you so much for taking your time, and I'm so glad Dr. Wang made it. He was just a minute late and was very
1 minute.
impressed.
Yeah.
Thank you so much for being here.
We really appreciate it. Thanks
Appreciate
for
it.
having us. Yeah.
All right, Dr. Ryan Bolt and Dr. Alexandre Wang right here with us. We have had an interesting conversation. This will be posted on our Facebook page, and then it will also be posted on our website, WCRS1450am.net. It'll be there forever, but go back, recommend people take a look at it. I think we learned a lot about the robotics and about colon cancer awareness and treatment, knowing that Colon Cancer Awareness Month is coming up in March. That, my friends, is going to do it for us here today. So thank you so much for listening here and for being part of the show. That'll do it. Bye-bye, everybody. Take it away.